name is Dr. Millay. I want to talk to you about a personal subject right now, and this is thyroid function. I did my full blood workup. I do that actually every 6 months at this point. And I found out that one of the crucial things that I needed to do personally to manage my own personal weight was to balance my thyroid. Now, a lot of my patients come into the office and they're always on thyroid medication, whether it's Synthroid or levothyroxine or whatever it may be, but something that's trying to create this balance in the way their thyroid is functioning. Let's step back for a minute, because I think this is something that needs to be addressed, and it's one of the key legs, so to speak, in really permanently being able to handle your weight control or weight management problems or issues that we all face as being part of our society. Long story short, the thyroid is controlled by a gland called the pituitary. Now, if you can imagine, this pituitary is monitoring everything that's going on in the bloodstream, and it's looking for very specific levels of what is called T4. Now, T4 is the thyroid hormone, or the hormone that is produced by the thyroid, and it's looking for very specific levels. If it senses that there's a low amount of T4 in the bloodstream, it's going to turn around and increase the volume. It's going to tell the thyroid, put some more out. Well, the thyroid will create more T4. Problem is that T4 is not the usable type of thyroid. In other words, it's the hormone that is the precursor to the one that is actually used to regulate metabolism of body size. The body is relied on to convert or to peel off one of those and convert it down to what's called T3. That is the usable form of thyroid in the body. And so the project becomes, why is it that we have too much T4? Where's that conversion happening? And is that conversion happening appropriately? Because maybe it's not a T4 problem, maybe it's a conversion problem. As you look at it, 60% of the conversion of T4 to the usable T3 happens in the liver. Now, for most of us, our livers are bombarded with chemistry and toxins and bad food and everything else that we do for a whole lifetime of problems. And the liver has a storage and a memory of all these different toxins that we're using and or we're exposed to. So in doing that, we decrease liver function, and thus some of the problems with the thyroid may be pointing directly over to the liver. So I always recommend to my patients, number one, clean your liver. Do an appropriate detoxification. In fact, we're going to do a whole nother video just on detoxification, because a lot of people think, hey, it's just it's a bad bathroom experience for a weekend, and that's not what detoxification is all about. There's very specific things you need to do. So back to the thyroid, the liver needs to be clean. Number two is we want to make sure that you have appropriate probiotics in the gut. These are the crucial things where that conversion of T4 to T3 take place. Now here's the pituitary trying to regulate the balance of what's happening in the bloodstream. The gland, the thyroid itself, is trying to regulate body size and your metabolism and speed it up in such a way that you can have an occasional birthday cake and not have a problem, or be equal at least to the person next to you that has a metabolism that's going nuts. So the bottom line being, thyroid becomes extremely important. You need to cleanse your liver. You need to develop proper gut probiotic balance, and we can talk about that later. But thyroid becomes extremely important. I highly recommend taking the quiz on thyroid and find out if your thyroid is functioning low, if you have low or hypothyroid indications. And the other thing is that there's actually a real little homework deal that I give, a real powerful little homework thing that I give my patients, and that is to actually, and I want you to download it, there's a little worksheet that we're going to put online. So take the quiz, download the homework, and the homework is about taking your temperature in the morning. And there's some very specific instructions on how to do that. And you're going to be able to identify if your thyroid truly is an issue. Sometimes even blood work may miss it. So it's very important to not only just do the blood work with your doctor, but also do your own homework so you're able to cover all bases, so to speak. So again, my name is Dr. Millay. I appreciate it. Thank you.